In this video, we will demonstrate a single interrupted stitch with an instrument tie. To perform a simple interrupted stitch, cock your wrist back and position the needle perpendicular to the skin. Drive the needle into the skin and turn your wrist and let the curve of the needle do the work. Depending on the width of the bite and the length of your needle, you can either take it in one bite, like so, or two. If you take it in two, reinsert the needle directly opposite where the needle is exiting at the same plane or depth. If you fail to do this, the skin edges will not align properly. Turn your wrist and drive the needle out the skin. It should be at the same distance from the skin edge as the site of entrance on the other side. To perform an instrument tie, pull the suture through until there is only a short stub of suture left. It should not be too short that it will pull through with a small yank, but not too long or else it will be cumbersome to work with. Wrap the suture around the needle driver toward the opposite side and grasp the free end of the suture with your needle driver. Pull the needle driver and suture back in the opposite direction toward yourself. To perform the equivalent of a surgeon's knot, wrap the suture around your needle driver twice before grabbing the suture. This will ensure that the first throw is tight and will not loosen when you release the tension on the suture to perform the second throw. To perform the second throw, wrap the suture around your needle driver toward the free end again. Grasp the suture with your needle driver and pull it in the opposite direction. As you tighten the throw, you should note that the knots you are creating are lying flat, and thus your knots will be square. Repeat several throws in alternating directions, and then cut your suture.